Hi everyone, I'm Dr. Amir Karam. I'm a board-certified facial plastic surgeon and I specialize in facial rejuvenation. And today I want to talk to you a little bit about a common question that comes up all the time. And that is, I'm interested in having a facelift, I'm interested in having surgical work done, but I've had a history of threads, I've had Botox, I've had fillers, I've had all these things put in my face, and is it okay? Do I need to get those things removed? Do I need to let the fillers dissolve? Do I need to get the threads removed, etc.? So let's jump right into this question. I think it's a broad enough and very common question that comes up, and I'd like to help you navigate through that. So the typical evolution for most patients as they approach the ages where they start to see aging and the changes in their shape of their face, etc., the typical evolution is you're somewhere in the mid-40s or so. You start to notice that facial volume is now lost to a point where you start to look a little hollow around the eyes, the temples, the cheeks, the lips. Everything starts to look a little bit deflated, and you start to see lines forming around the middle of your forehead and in between your eyes and in the crow's feet. And as you age a little bit more, you get into the late 40s, you start to notice that the jawline is not as crisp as it used to be. Suddenly there's a little bit of early jowling, maybe a little bit of laxity in the neck. The midface starts to drift down and you start to see heaviness in the midface as the nasolabial folds get a little bit thicker and heavier. So you say to yourself, I'm still in my 40s. Surgery is probably not the not the right time for me. So why don't I consider doing some Botox, some non-surgical techniques like fillers in my midface to try to lift up this area, try to put some fillers in my nasolabial folds to make that area softer, put some Botox in around the eyes to help those wrinkles from looking as deep. And then, you see that those things are borderline working, they're reinflating, the lost volume a little bit, but not quite correcting things. So then you say, all right, what's the next step? Maybe there's some radiofrequency devices, some lasers that might tighten my skin. Think about thermage, you think about deep RF microneedling devices and Ultherapy, etc. So you go down that road for a little bit, still no real change. You're still kind of back to square one. Your jawlines are now a little bit heavier, and you're thinking, okay, well, let me go and have some threads put in. Maybe that'll help lift up my cheeks and help correct some of these things. So you go in and you get these PDO, which are absorbable threads, put into the tissues. For a couple months, things look pretty darn good. You're like, okay, this is progress. I'm seeing some changes. It looks good. And 4 months later, 6 months later, all of a sudden, you're back to square one. Nothing held up because these are absorbable sutures, and even though they claim to create collagen and somehow stabilize the tissues, you realize soon enough that unfortunately that's not the case. So now you're left with the last card in your hand, which is, all right, now I want to really get rid of this because this is looking worse over the last few years now, and none of those other things worked. And if you're lucky enough to have literally just tried them just a couple times and said, all right, this is not working, you're ahead of the game. The typical patient, and you might be one of them, you have had treatments over and over and over again, maybe over a 5 to 10 year period, until you finally come to this point where now you're interested in having surgery done. And now the question comes in, with all the things that I've done, is it a problem to have a surgical procedure? So rest assured, the answer is no problem at all. If you've had Botox, if you've had filler, if you've had lasers, if you had radiofrequency devices, if you had threads, all of those things are in the past. They have nothing to do with what a surgeon has to do at the time of the procedure. Now, if you're one of these individuals who've had the non-absorbable sutures, those threads, or just recently had the thread, yeah, we might run into them as a part of our procedure. We might see them and have to clip them or remove them, but that is not going to keep us from being able to do what we need to do surgically. The time that it gets a little bit tricky, however, is when somebody who has had filler after filler after filler all throughout these areas, the tissues become a little bit stickier. They become a little bit more difficult to work with, more scar tissue, because as these fillers are literally dissolving, your body is breaking them down and causing inflammation and therefore scar tissue. So what we end up seeing in these cases is, the surgical procedure becomes a little bit more, challenging, but still doable in the hands of a careful surgeon. They can get through that scar tissue and still get a great result. But the point, I think, is when it comes to changes that are resulting in laxity, jawline, neck, all that stuff, when your facial shape starts to change and you're in the mirror, oftentimes, and you're kind of going like this and you're like, oh geez, that looks so much better, I want to achieve that. Let me tell you, You're not going to achieve that with non-surgical treatments. What you're doing right there is you're basically lifting your face in a vertical direction, and you're emulating what a vertically oriented lift will do. Like in my practice, I perform the vertical restore, which is my trademark procedure that combines deep plane vertical lift in addition to the elevation of the lateral brow area and the neck area. So it kind of ties all these areas together. You're not going to get that non-surgically. This is a very advanced procedure, for example. I mean, it's not simple to perform. We do these under local with IV sedation, and the recovery is just a couple weeks. It might seem easy, but what's happening technically is a lot more than, thread placement or filling with a little bit of filler. But the bottom line is, if those things have happened and you have had that history, do not fret. Whenever you decide to give up on that adventure, you'll be fine. You'll be able to get the results you're hoping for. The only thing I would strongly advise is don't overdo it with the fillers, because that can sometimes distort the face in an unusual way, and that is oftentimes permanent. I've had to turn patients away, unfortunately, throughout the years because they just were too far off in terms of the overall facial shape and the permanence of these fillers, because again, remember I said they transform into scar tissue because of the chronic inflammation as they're trying to break these fillers down. So if you're doing it over and over again for years, the tissues just all become scar, and it's not like you can dissolve it. It just won't lend itself to a good surgical outcome. But the other treatments, they're not going to cause too much harm, although I have to say, and some of you may relate to this, some people who've had deep radiofrequency microneedling, I'm talking about like 3 to 4 millimeters in depth, or have had Ultherapy in deep levels, sometimes what you experience is a loss of fat and a melting away of that sort of subcutaneous fat that causes the face to look a little bit more depressed and deflated. I've heard that and seen that, but otherwise, you're good to go. And I think you're on a good path. If you're even questioning this, you're already obviously on a good path to getting a real rejuvenation result. So I hope that helped answer that question and give you a little bit more clarity over the topic in general. If you have any questions, please jot them down in the comment below. If you haven't already, take a moment and hit subscribe so you can get more information like this. I post 1 to 2 videos a week on the topic of facial rejuvenation and skin rejuvenation and anti-aging procedures and go over all this stuff. So I think it'll be good if you're interested in it. And please share this to friends and family who I think could also benefit from it if they have an interest in it as well. And don't forget to like the, the video if you enjoyed it. All right, thanks so much. And until next time, Dr. Amir Karam, and we'll see you then. Bye-bye.